Smoking, a deadly habit. I'm Kayla Hill.
And I'm Amanda Lee.
We are here today to discuss the effects of smoking. Some of you may ask yourselves why someone would start smoking in the first place. Well, here are a few things that can come to mind.
Many people start smoking at a young age, usually due to peer pressure. This usually happens around middle school, but can happen even earlier, especially if the child is around an older adult who smokes.
They've seen adults smoke and think it's an acceptable habit. Role models, mothers, fathers, family members who smoke make this habit seem acceptable.
To feel acceptance, that's all anyone wants, and some people will do anything to achieve this.
To cope with stressors in life, work, home, school life.
Curiosity turns into addiction. Some people think that one will just be one, but it can always lead to another.
Weight loss. Cigarettes can suppress appetite and help keep you looking thinner, but at what cost?
What are the risks associated with smoking? Cancer, caused by the various chemical ingredients in cigarettes. There are over 80 chemicals in just one cigarette.
Reduced fertility can affect your ability to become pregnant and the length of time it takes to conceive.
Heart disease. Cigarettes cause the lining of your arteries to become more narrow, increasing your chances of a heart attack.
Hardening of the arteries.
Asthma.
Lung disease. What effects does smoking have on your lungs? Smoking can affect how the lungs filter air, causing irritation and secretions of mucus. With the extra mucus, the person can become susceptible to asthma, chronic bronchitis, COPD, and emphysema.
Types of cancers caused from smoking: oral cavity, including your mouth, tongue, and lips;
your nose and sinuses;
your pharynx, or your throat;
your lungs;
your larynx, or your voice box;
your esophagus;
stomach;
pancreas;
cervix;
kidney;
bladder;
ovary;
acute myeloid leukemia, and many more.
What can you do to quit? Set a quit date. Help choose a date to stop smoking. Avoid stressful times in your life.
Write it down. Make a written list of the reasons you want to quit smoking. Review it often to help stay focused and on track while kicking the habit.
Practice saying no.
Consider stop smoking medications. Review the options: nicotine patches, oral medications, chewing gum. Also speak with a family physician. They may be able to prescribe something.
Find a support group. This may help keep you on track by being able to talk to others in a similar situation as yourself.
Prepare for a rocky road. There will be cravings, withdrawal symptoms, and other things that will try to hinder your efforts.
It may be difficult at times, so prepare yourself for setbacks and temptations. If a slip-up happens, remain positive and supportive. Acknowledge the progress made and encourage not giving up. Identify what went wrong and what to do differently next time. Make it to 1 day, 1 week, 1 month. Above all, celebrate the progress made. This is going to be a long journey. Rewards and positive reinforcement can help maintain the motivation to stop smoking for good.
Benefits to stopping. Personal: your breath, clothes, and hair no longer smell like smoke.
Stress and guilt. Now that smoking is actively discouraged just about everywhere you go, just finding a place to smoke can leave you stressed out and guilt-ridden. Not smoking means no more looking for a place.
Health of family and friends. Smokers expose friends and loved ones to second or third-hand smoke. No smoking means no more putting loved ones in harm's way.
Financial burden. Smoking is very expensive. Stop paying the high cost both health-wise and financially.
What happens after your last cigarette? 20 minutes. Your body begins to heal itself. Blood pressure drops to normal, pulse rate drops to normal, and body temperature of hands and feet increase to normal.
8 hours. Carbon monoxide level in blood drops to normal. Oxygen level in blood increases to normal.
24 hours. Chance of a heart attack decreases.
48 hours. Nerve endings start regrowing. Your ability to smell and taste is enhanced.
2 to 3 weeks. Circulation improves. Walking becomes easier and lung function increases up to 30%.
1 to 9 months. Coughing, sinus congestion, fatigue, and shortness of breath decrease. Cilia regrowth in lungs, increase ability to handle mucus, clean the lungs, and reduce infection. Body's overall energy increases.
1 year. Excess risk of heart disease is half of that of a smoker.
5 years, lung cancer death rate for average smoker decreases by almost half. Stroke risk is reduced to that of a non-smoker.
5 to 15 years, risk of cancer of the mouth, throat, and esophagus is half of that of a smoker.
10 years, lung cancer death rate similar to that of a non-smoker. Precancerous cells are replaced. Risk of cancer of the mouth, throat, esophagus, bladder, and kidney, and pancreas decreased.
15 years, risk of coronary heart disease is that of a non-smoker.
How can you expect to feel after quitting?
Nausea,
Vomiting,
constipation, diarrhea,
cravings,
weight gain,
headaches.
and many more.
It will take about 2 weeks for the symptoms to start to disappear. Be patient. It is the most critical time to being successful with quitting smoking.
Other forms of nicotine. There are more products out there than the traditional cigarette. There are clove cigarettes, candy-flavored cigarettes, and hookah, which is the smoking of tobacco through a water pipe. There's gum, vaporizers, and the patch. Along with being highly addictive, many of these products deliver higher concentrations of nicotine, carbon monoxide, and tar than that of traditional cigarettes.
Secondhand smoke. What is secondhand smoke? Smoke inhaled from others smoking tobacco around you.
What are the effects? Allergies, breathing problems, irritation to the eyes, nose, throat, lung and heart disease, plus many more.
How can you prevent it? Avoid places where people are smoking. Support businesses with no smoking policies. Hang around with people who do not smoke.
Where to get help? There are lots of resources to get help when quitting smoking. Here are a few that may help you.
Support groups,
Family and friends,
websites including the Smokers Helpline, Health Canada, Canadian Cancer Society.
Thank you for watching our presentation. If you have any questions, comments, or concerns, please let us know.
Thanks, everyone.